Good evening, ladies and gentlemen. Welcome to another exciting episode of Paul Brown Show. This evening, my guest will be Miss Linda Lynah. And I hope I said that right.
Yes, you did.
And she'll be talking about open enrollment. And we're taping live at Studio to Expose You. How are you doing this evening, Miss Linda?
I'm blessed and highly favored.
Great, great. Tell the audience a little bit about yourself.
As you mentioned, my name is Linda Lynah. I am a outreach supervisor as well as a community relations liaison with James-Santee Family Health Center in McClellanville, South Carolina. My primary job is to educate the community about services that are available not only at our facilities, in which in total we have 6, but also to make them aware of the different programs that are available to them, whether they're insured, underinsured, or uninsured.
What inspired you to want to deal with health care?
I think it was ordained by God.
Yes, ma'am.
And why I say that is because of the steps that was taken for me to get to this point. And basically what has occurred is that I have been working in various areas that eventually led me to a culmination of things that I needed to do in order to assist people in the community.
Why is health care so important to have?
Well, like it says in the Bible, with long, healthy, and prosperous life will we satisfy him. And the only way that we're able to do that is we have to take care of ourselves. And one of the things in order to be able to do that is we do need to go to the doctor on a regular basis. And if there is a problem, then we need to check it out immediately. Unfortunately, a lot of times people don't go because of beliefs or because they don't have insurance coverage because they can't afford it. And what ends up happening is they end up, going in the hospital and collecting a large medical bill.
Okay. So we have Medicare, they have open enrollment coming up. Tell the audience a little bit about open enrollment.
Sure. Basically, the Medicare open enrollment began on October 15th. And it will go until December 7th. With that, individuals are able to, at age 65 or older, people that are under 65 with certain disabilities, which means that you would have had to have been disabled for 24 months, or people of any age with end-stage renal disease, or what is called permanent kidney failure requiring dialysis or a kidney transplant. With Medicare, there are different parts to it. Part A, which is your hospital insurance. Then you have Part B, which is your medical insurance. You have Part C, which is your Medicare Advantage plan, and then Part D, which is your prescription coverage.
Okay, you said that the age for the Medicare, 65 and over and all, what would be like the difference between Medicare and Medicaid?
Medicare is a program that's based on your work history, where you've had enough quarters of coverage to be able to get Medicare. Whereas with Medicaid, it's on a base need, which means that you would have to meet certain criteria in order to be able to get Medicaid, such as being pregnant, or your child and your family income meets the requirement up to age 18, or if you're an elderly person and you do get Medicare, and your income limit is less than what is allowed under what is called age blind and disabled, then you can qualify for Medicaid, and that's where the difference comes in at.
Okay, you described when you were talking about the Medicare health insurance, the different criteria, 65, they had to have certain disabilities, what would be considered some of the disabilities that they may have?
The way that Social Security states it is that the individual would have to be unable to do substantial, gainful activity for at least 12 months or more.
Okay.
And then if that is determined, then they are considered to be disabled. Now, the thing is that once you turn 65, you would go to retirement and not disability.
Okay. All right, great. Okay, also when we're talking about the Medicare, the fees are Part A, Part B. You talk about the Part A, the hospital. Part B is the medical. Can you describe the difference between the two?
Well, with Part A, which as you mentioned is hospital, you don't pay for that. However, Part B, you do. And what you do is you would have to pay $135 a month. However, there is a program that's called the Medicare Savings Program. And with that program, it's based on income and resource. And if your income meets certain criteria, then Medicaid would pay your Part B for you.
Okay, some of the criteria with the saving program is low income subsidy. You have qualifying individuals, qualified Medicare beneficiaries. Okay, do you have like a income like scale that people may have, or how would they go about doing that?
Yes, there is an income scale. And, okay, as you mentioned, for your low income subsidy, your individual monthly income limit has to be $1,518. Your household monthly income limit has to be $2,058. If you're qualifying for what is called the qualifying individual, which pays Part B premium for individuals with higher monthly income, individual monthly income must be limit 1,366. Household monthly income limit is 1,852. If the individual qualifies for what is called Qualified Medicare Beneficiary Program, which pays Part A and B premiums, co-payments, and co-insurance and deductible, then that individual monthly income limit has to be $1,012. If it's a household monthly income limit, it's $1,372. The next saving program is called Qualified Disabled and Working Individual, which pays Part A premium, and the individuals with monthly income has to be $2,024. Household monthly income is $2,744. The other and final Medicare saving program is called Specified Low Income Medicare Beneficiary, and that pays Part B premiums only. And the income has to be $1,212, or the household monthly income is $1,646. If the individual qualifies for any of those programs, then what happens is that that money that's been taken out for Part B is put back into their check.
Why is it so important that people are aware of this type of information to show their qualifications?
Well, one of the main reasons is, and especially when you're looking at senior citizens, they're on a limited income. And so if they're able to get more money to be able to live, then it's a good thing for them to be aware of. The other thing that's good about it is that if they do have these programs, then right now we're talking about open enrollment, which is from October 15th to December 7th. If they have these programs, they can go in and change their Medicare plans at any time without any problems whatsoever.
Dual eligible. Can someone be eligible in both Medicare and Medicaid? Dual.
Yes, you can. And there's two circumstances by which it would occur. The first one is what we call Prime, and that's for seniors 65 and older, where they are eligible for both Medicare and Medicaid. When that happens, then they get one card, which they would be able to utilize, and they have one provider that provides and assists them with their services. The other is where you do have both Medicare and Medicaid separate cards, which would allow you to have your Medicare as your primary and your Medicaid as your secondary.
That's some very important information that you're providing to our viewing audience. And, you know, I see that a lot of people just not aware that this information is available.
That's correct.
You know, I know how, being that you've been in this type of service for so long, for some of the viewing audience, how would they go about getting in contact with you?
Basically, they would be able to call me at my number, which is 843-826-3773.
Okay, and you work for the St. James?
That's correct. I work with St. James-Santee Family Health Center, and our main office where I am is located in McClellanville, but we also have 5 other sites in Georgetown County, and one of those sites is a pediatric practice. So we do have workers at those sites as well, which can assist with the assistance in applying for health coverage.
Okay, we also have open enrollment for health insurance. Tell the audience a little bit about that, and when does that start up?
Okay. As you mentioned, the health insurance marketplace open enrollment will begin on November 1st and will go until December 15th. And with that, everybody pretty much is aware of it as being Obamacare. And basically what it does is that it will allow you to be able to get insurance if you do not have insurance on your job. The one drawback with it is that your income has to be at least 100%. If you're less than 100%, then you're not able to apply for that particular program. So as we are aware that one of the things that President Obama had put in place, and it was up to the states to decide whether they wanted to do it or not, is the Medicaid expansion. Unfortunately, in the state of South Carolina, we weren't given that option by the governor. So what the governor at that time, which was Nikki Haley, did was to put in place what is called Healthy Connection Checkup, which will allow an individual to be able to get a physical every 2 years and to do screenings at that time. After that, that's not available for another 2 years. So basically, what we do at St. James-Santee is that if an individual has that, which is a blue card, then we will allow them to come and be seen at our facility for $10 per visit, which would include on-site labs. As far as with the marketplace itself, it has a fantastic program. We've seen over the years that many people have joined. It's a situation where if you have Medicaid, you don't need to join, or if you have Medicare, you don't need to join, or if you have private insurance, you don't need to join. Your amount that you pay is determined by your income and your family size, which in some cases, some families have actually paid $20 a month for their premium for a $800 insurance. And basically, we have certain insurance carriers that are our carriers for those particular insurance. And that's Blue Cross and Blue Shield, Molina, and Better. So what the individual would do is they would come in, bring all the information, and if you are in a household and anyone that's in your taxes, you have to bring in their information. Once you bring that in, then the determination is made as to, you know, what plan you would like to have. You have a bronze, you have silver, you have gold, and you have platinum. And basically, once you've made that decision, then you sign on to the plan, and then the plan is good for at least a year. Now, say for instance, for individual that may have signed and something happened in their personal life, say they had a child, they got divorced, they lost a family member, then they can go into what is called the special enrollment period and be able to make or enroll based on that fact.
Okay, they call it Obamacare after President Obama. Why did President Obama feel like this was such a great thing that we needed in our country?
Well, for one, what was happening is that because people didn't have health insurance, and like I said, they would wait to the very last minute to get care, and by that time, they ended up being in the hospital and accruing $1 million bill, which the hospital or taxpayers were responsible for. So, you know, it's a known fact that if you do preventive, then your cost is less and you're more likely to live longer and live healthier.
I think a lot of people are not really, they're having a primary doctor, physician, that you are seeing on a regular basis. Why is that so important? I mean, that we take for granted that, you know, to have someone, a physician that you go to on a regular basis, that they know you. Why is that so important and we take that for granted?
It's important because preventive is the key. And the only way you're going to prevent something is you need to follow through. And in following through, then that means that if there is a problem, then they are able to get on it right then and there, which means the earlier that you identify a problem and resolve it, the better chances of you overcoming that problem and living a longer life.
And by going to a regular doctor, it kind of like, you get that kind of like a bond with them, whereas they kind of like know you and you're able to be more comfortable with, you know, communicating with them some of the symptoms that you may have.
That's correct.
You know, and that's, I think as we get, especially up in age, we kind of not tell exactly some of the problems or symptoms we have, but if you have that regular doctor that you go, he can kind of like tell, and he's able to, you know, let you express yourself more.
That's correct.
And that's something that will put more years on your life.
That is
Because
correct.
that diagnosis, that early diagnosis, is a key to longevity.
You're absolutely right.
Mm.
You're absolutely right.
How do I get health insurance on that marketplace?
Basically, you would need to contact a counselor, or you can go online. You can call the marketplace number, or you can call one of our federally qualified community health center, because we, as outreach workers, we have to take what is called the certified application counselor exam and be qualified, so that way we can assist you in being able to get enrolled. And at the point of contact, then we're able to explain to you what is needed in order for you to apply, as well as we can assist you. And we can assist you two ways. We can either assist you over the phone, or we can assist you in person.
Does South Carolina have state health insurance?
To a certain extent, the Medicaid is what you consider as a state health insurance. And then also you have what is called SHOP. And what that's about is if you work at a company that has X amount of employees, then you would qualify for that, and you would not need to go into the marketplace.
Can I get health insurance without going through the marketplace?
Yeah, you can. You can actually contact a local insurance carrier and see what they have available. And as I mentioned, you can also talk with your employer to see if they have health insurance available.
I know we have a lot of programs for our youth, and then you have some programs for the women that's pregnant.
Right.
Tell us some of this. I think you said something about a CHIP program.
Right. That's the Children Health Insurance Program. And basically what that does is that with Medicaid, of course, everything is it's centered around income. So in order to be able to give parents that have a little higher income, then you have the CHIP program where they can sign their children up for it and be able to get Medicaid coverage for them. And so that in itself makes a difference. And with the other programs, you have what, like you mentioned, the pregnant women. That's if your income is at 194%, then you can apply for that. Then there's also a program that's called the Parent Caretaker Relative.
Okay.
And your income level would be at 62%. The other thing that an individual can qualify for Medicaid is those children that have been in foster care. Then they're eligible for Medicaid up until age 26.
Foster care. I know a lot of people are getting into the foster care as far as helping the kids, little children come out. Why is that important for them to be aware of that?
Well, because a lot of times kids age out of the system, and when they do, they don't realize that they still have health coverage. And again, as we were talking before, you know, they may not be able to feel like they can afford it, so they don't get health coverage.
Right.
And if they know that it's available, then they can utilize it until age 26. And then by that point in time, they'll probably be able to afford or get some form of health coverage through a job.
Linda, how does it make you feel when you see people in the community coming into St. James-Santee Family Health Center seeking that health?
It makes me feel great. And I'm going to briefly tell you a story about a customer that I had. And with his situation, he was an amputee. And he was in between, like I mentioned, when you're on disability, you are not able to get Medicare until after you've been on for 2 years. So here he was, an amputee. He wasn't working because of his disability, and he needed a form of coverage to be able to have his care ongoing. So when he came to me, we looked at the fact that he was disabled. So therefore, we went to Social Security and made sure that was established. And then after that, he was able to get on the marketplace so he could have insurance to continue his care. So with that, that made me really happy, because now I know that this person, you know, has health coverage to be able to take care of himself, even though he has a disability.
And there's a lot of information that a lot of people just don't inform people of, that
Exactly.
they, you know, and for them to be better aware of what's available, it makes them live longer.
Exactly.
You know, and there's so much expertise that's at St. James-Santee. And if someone wanted to contact, how would they go about doing that? The number.
As far as our number, you can contact my number, and then if you're in a different location for myself, then I would be able to direct you to which number you would need to call. And again, that number is 843-826-3773.
And y'all open up Monday through Friday, 8 to 5?
The way our hours work is Monday, Tuesday, Thursday, and Friday. We're available from 8 to 5. And on Wednesday is our late night, so we're available from 9:30 to 6:30 p.m.
Okay, going back, Linda, if someone wanted to get in contact with you, how would they go about doing that? Because we're running short on time.
Sure. Once again, that number is 843-826-3773. And as indicated, my name is Linda Lynah, and I'm the Outreach Supervisor for St. James-Santee Family Health Center, Incorporated.
Ms. Lynah, I really appreciate you coming on the show, educating the audience on open enrollment, health care, the importance of having that, taking care of yourself, because that's a very important thing and not something to take it for granted of. And anytime you want to come back on the show, I look forward for you coming back on.
Okay, thank you. I'll be glad to come back.
Ladies and gentlemen, thank you for watching this show, and you be encouraged. Thank you.